Right now, I am 2 days post-op. I'm having trouble speaking because the tongue on my left side is swollen. I think it's intubation or something. So, here it is so far. This is swollen. Like, these parts are painful. And my back is itchy because of the velcro of this bandage. It, it feels like there's some kind of like thing here that's like gushing because like it feels like there's like a sack of something because every time I bend over I hear like a gushing noise and I can't I can't lift my arms here but I cannot like but it will hurt along the way but it's tolerable. I can turn around to flush fortunately. I regained and some energy today yesterday and after after my surgery and um, one day post-op I was really like I was drained. I didn't have energy at all, but now it's like the second day I have a little bit of it. Like I can walk now and it used it hurts a lot yesterday but now what hurts is more of the bandage that's like holding everything together. It's so tight and it's not comfortable at all. What also hurts is like underneath where the incisions are. I can feel it on my side as well. I've been yesterday I've been sleeping the whole day. I've been really like I don't know. I wasn't. I just slept the whole day yesterday. I would wake up to take my meds and wake up to like eat and drink. But most of the time I would be asleep. I also lost a lot of appetite. I don't want to eat at all, but I know I had to, so I would have to like force force feed myself. There's a dog barking. Oh. I don't have drains, but and it's red here in my underarms. That's weird. I wasn't red, but now it's red. But my tongue hurts the most. Yesterday was my 5 days post-op. It was also my first follow-up appointment. The doctor removed the nipple bolsters and replaced the dressing. I still have to be compressed with this bandage, unfortunately. So, oh, oh no. This is what it looks like. This is the waterproof. This is the I chose the waterproof gauze, but I will not next time because that was painfully overpriced. And because the benefit of this is that I can shower. Otherwise, if I choose the or just the regular ones, I'll need to I can't like shower. I'll have to just pat myself down. But I didn't know that this was extra charge, so I'm not going to do it again. And these are kept to like, because I had lipo here, so these are kept to like hold it in place. He removed like some stitches on my nipples, and this one, the nipple here, it has some color, like a really like little like color into it. So I hope it's gonna heal well. This one, not so much. He didn't like touch it. He used like the cotton ball and he just like rubbed around it. It's weird because I can feel it, but at the same time I can't feel it. My incisions go all the way like here, and for the other one it goes like here as well. As you see, it goes all the way to the back. They also told me to like stop slouching because I keep slouching. So okay, I won't slouch. But it's weird. It's such a weird feeling to like slouch, like, cause I don't have any. Cause when I was pretty, I would always like slouch. I think many people know why. But now I don't have to slouch anymore. But because this um tape here is really like tight, it's like if I try to like move back, it's gonna like the tape is holding me together. It's not the stitches, it's really just the gauze and the tape. So that's why I'm still slouching. But they said the doctor said that I should like stop slouching and also to like do this sort of exercise and where I stay by the wall and just slowly like raise my arm, and the higher it goes I get closer to the wall so that when I reach so that it can like this is just some shoulder exercise that I was told to do. For some reason I don't have much like problem with my left as compared to when I do it to my right, because I feel a lot of numbness in my underarms, which is where the liposuction was. Yeah, but like the tape is so itchy. So next Saturday is my 2 weeks post-op, which is the day that they will remove the stitches. I don't know if I'll have other follow-ups after that, but that's all I'm aware of. What should I talk about? There's a lot of like when I read online and like Reddit or like watch YouTube videos, they would also talk about how you need assistance for like certain things. For me, I did have my partner, my girlfriend help me with things because I can't pick things up on the ground, and it hurts to bend. But for some reason, when I twist to do this to like flush the toilet, I don't have a problem. Maybe I'm not supposed to do that. Sleeping is also very, very difficult for me because everything just hurts. I can't sleep straight anymore. I wake up and I fall asleep. It's just really uncomfortable, and my butt is really painful. It's really numb for like sitting for hours on a bed just trying to sleep. My incision is actually like across one long one across my chest. It there is like a middle point, but it meets there like just a really little point. So it is really just one long line. Is this even like clear? I think now I don't remember what exactly happened in the. Did I even talk? Okay. So I feel like I'm in a better like I have more energy to talk about what happened on the day itself. Turns out I had my surgery done for like 9 to 10 hours. I left the area. I left the hospital around 1 in the morning. My girlfriend wasn't able to like go inside because she needed like an antigen test. She did one, not because of that, but she was required to do it for like work. So fortunately she was able to use it as well for entering the hospital to like pick me up. But I was waiting there for like I was supposed to start at 9 and I was waiting there for an hour. I think the surgeon was like late, he was stuck in traffic. I'm not sure because when I look outside it was like heavy traffic. Going to the hospital wasn't like a problem for me because I actually just live nearby it. And it's like across the road. I'll just walk there. So I was pretty much early, and it was also I was waiting for about an hour and the surgeon arrived. I used the washroom one last time. I got dressed with the hospital gown thing, and then he measured my chest for like another hour because I, I feel like it was partially my fault because I kept like fumbling around. I was like moving because I was like it was because of the felt tip pen that he used. Every time he drew around my nipple, for some reason, it hurts. It feels like it just hurts, and I don't know why. And he kept like measuring, and he was like looking, and then examining, putting a ruler, and then he's like, nope. Then he would erase it and like draw it again. But I'm like, and then that took an hour. But to be honest, as long as it comes out perfectly, then it's worth it's but honestly it's worth taking your time to do something like that because it better come out right. And then they put me on they made me lie down on the bed, and they put I think that was I don't know if that's like, I think they put the IV, and then or they injected anesthesia. I'm not sure. They just put it there. They didn't tell me what it is. They just put it there, and then they asked me like, "Are you?" And they checked my blood pressure. I was strapped up, and they asked if I smoke, if I drink. I was like, no, no, no. If I have health conditions from my family that I inherited from my family, I was like, no. And they're like, okay, that's good. And then, because I was wearing a face mask that time, the moment one of the doctors said, okay, I'll put down your face mask, that's when I blacked out. And I did not remember, I don't remember blacking out, but that was my last memory I had. Because in movies, they show it like you slow, in the movies, the doctors would be like, you start to feel sleepy, so, and then it would show like gradually falling asleep. But no, for me it was like, it was for me it was just like pitch black. They didn't even like say anything to me. I think they put something in my mouth because when I woke up, my tongue is really, the left side of my tongue is really swollen, and all I remember was, I really do not remember anything I, about how I blacked out. They just said, okay, I'll pull down your face mask, and then I was gone. I woke up. I don't know what time I woke up, but I was told they were done around 10 o'clock p.m. I went there at 9 o'clock in the morning, and then I was done at 10 o'clock. But then I don't remember what time I woke up, but when I arrived, when my girlfriend came in, I checked the time. It was like 1:30 because they woke me up to like get me out of the anesthesia, and they're like, I was lying down, and then they said, okay, please sit up. So I sat up. Then I just went back to sleep, and then I don't know how long I was asleep for because I was really exhausted. I was really exhausted, so I went back to sleep, and I don't know how long I was asleep for. The second person that woke me up was a surgeon. He said that, oh, Fiona, he was like, your girlfriend is here, but we can't bring her in because there's another patient in the recovery room, which was like right next to me. And I was like, oh, okay. Then I went back to sleep, and I didn't know how long I was asleep. But then it was it was the kind of sleep where it's like, even you're asleep, if someone calls your name, you will wake up. And you can hear it and you wake up. And that's what happened. So when the surgeon called my name for the third time, I woke up. Then, yeah, that's when I saw my glasses, I got it, and then I checked the time. It was like 1:30 in the morning. And I was like, oh, okay. So yesterday I had my stitches removed, and it's the first time I've seen my chest without stitches. The experience was very like itchy. I don't I couldn't I do feel like the stitches being pulled out, but
painful. It's just really itchy. And I had the kind of like stitches that weren't the ones that will gradually melt. So that's why I had to have it removed. I'm still in bandages. I still have gauze across my chest. Here it is. I do not know when I will stop wearing this compression bandage, but I'm guessing about 1 month and 2 months post op. 2 weeks from now, which is October 18th, that marks my 1 month post op. It's such a great feeling to stop wearing binders now. It feels weird because it's such like a habit, like, oh, I have to put my binder on, but then I realize, oh, I don't need to do it anymore. My nipples are slowly regaining its color. It's at the moment it's pink, which is not the original color. The original color is kind of like brownish. I think the highlight of having the stitches removed was yesterday when the doctor was trying to clean off the scabs that can be peeled off. There was like blood on my left nipple, it just like dripped all the way down. But it's okay. It was just this. It was not no big deal. It was just really just the scab that hasn't really been hardened and dried up.